Bone on bone, 7 things that actually help before you consider surgery. If someone has shown you an x-ray and said the words bone on bone, I need you to hear something before you do anything else. Researchers have looked at thousands of these x-rays, and people with the exact same joint damage as yours range from severe daily pain all the way down to no pain at all. Same picture, completely different lives. That gap is where every option you have left is hiding, and almost nobody explains what's in it. I'm Dr. Mauldin, your health detective. I'm a doctor of chiropractic and a certified functional medicine coach. And I have spent years working with people whose knees were called bone on bone, people who were told the only thing left was a replacement. Here's the number that should change how you think about this. A systematic review looked at every study it could find comparing knee x-rays to actual knee pain. Among people whose x-rays showed osteoarthritis, the proportion who actually had pain ranged from 15% to 81%. Let that land. In some groups, only 15 out of 100 people with that damage hurt. So the cartilage gap on the film is real, but it does not decide your day. Something else is deciding it. Today I'm giving you 7 things that work on that something else. Number 2 is the one I see change people fastest, and it's the one nobody talks about. Let's start with the thing that has to go first because it's blocking everything else. The phrase bone on bone describes a picture. It does not describe your capacity. Cartilage has no nerve endings. Cartilage itself cannot hurt. What hurts in an arthritic knee is everything around it. The joint lining, the bone underneath, the fluid, the ligaments, the muscles, and the nerves reading all of it. That's why 2 people with identical films live completely different lives. One of them has an angry, inflamed, unstable joint. The other has a quiet, well-supported one. The cartilage gap is the same. I have had patients come in who could not bend the knee and could not get down a flight of stairs without turning sideways and gripping the rail. Their x-rays didn't change. What we changed was everything around the joint. So here is the reframe. You are not trying to grow cartilage back. You are trying to make a joint with less cartilage behave calmly and hold itself steady. That is a completely different job, and it's a much more possible one. Which brings me to number 2, and this is the piece almost nobody addresses. When a joint has been painful for a long time, your nervous system does something protective. It turns the muscles around that joint down. It dials back the signal. You didn't decide this. It happens below conscious level. Your body is guarding. The problem is what happens next. Weak, under-firing muscles let the joint move sloppily. A sloppy joint gets irritated. An irritated joint makes your nervous system guard harder, and around it goes. That's why so many people say the same thing to me. I've been doing my exercises and nothing is changing. Of course nothing is changing. You cannot strengthen a muscle your nervous system has switched off. You're pushing on a rope. In my practice, I use a technique called trigenics. It's a myoneural technique. It works on the communication between the nerve and the muscle rather than on the muscle alone. The goal is to re-engage the muscles that have shut down so the joint gets its stabilizers back. And I'll tell you honestly what I've seen. I have worked with people who could not bend their knee, people who had real trouble going downstairs, and the change has been enormous. Not because we regrew anything, because the knee finally had something holding it. Now, I want to be straight with you. This is my clinical experience, not a promise, and it is not a cure for arthritis. But if you have been doing exercises for months with nothing to show for it, this is very likely your missing piece. Number 3, and this one you can start today for free. An arthritic joint is an inflamed joint, and inflammation isn't only made in your knee. A lot of it arrives from your plate. These are the 6 I have people pull out first. Sugar. Blood sugar spikes drive inflammatory compounds and produce advanced glycation end products, which stiffen the tissue in and around the joint. Dairy. Conventional dairy is the one I see provoke people most. I'm not anti-dairy across the board, but it comes out during the trial. Wheat, and not just the gluten. Refined wheat behaves like sugar in your bloodstream. Soy, heavily processed and hidden in nearly everything that comes in a package. Pork. In my practice, this one shows up over and over in people whose joints stay hot no matter what else they change. And high histamine foods, aged cheese, cured meat, wine, leftovers that sat too long. If your joints flare and you cannot figure out why, histamine is worth investigating. Now here's how to actually do this, because eat clean helps nobody. Pull all 6 for 3 weeks, not forever, 3 weeks. Then bring them back one at a time, several days apart, and pay attention to your knees. Your body will tell you which one is yours. It usually does within 48 hours of adding it back. And most people find it's 1 or 2, not all 6. That's the whole point of doing it this way. You find out what's actually true for you instead of guessing. Number 4, and this is the one I use on myself. Cold laser. You'll also see it called low-level laser therapy or photobiomodulation. Uses specific wavelengths of light to reduce pain and inflammation in the tissue around a joint. Reviews of the research report reduced joint pain and better mobility in knee osteoarthritis. And I'll be honest about the limits too. The science is not settled on the ideal dose or wavelength, and nobody has shown that it regrows cartilage. Anyone telling you it does is ahead of the evidence. But for calming an irritated, painful knee so that you can actually move it, which is the whole game here, I think it's one of the most useful tools you can own. I use a handheld device at home. It's the one I keep right by my chair. I'll put the link in the description, and the code KM20 takes 20% off. And I do earn a small commission if you use that link. I want you to know that up front. I tell you about it either way. It's what I use. Now, quick thing while we're right here, and then I'll get straight back to it. A lot of you ask me which supplements I actually trust because the shelves are full of junk and most of it is underdosed anyway. I've put the ones I personally stand behind in my Dr. Mauldin Health Detective store. The collagen, the omega-3s, the magnesium, the nerve support, that's what's in there. You get 10% off always, just for being part of this community, and another 5% off your first order. That link, the laser, my book, and the free discovery call are all sitting in the description below. Everything I mentioned today is down there. All right, number 5, and it's the one people get backwards. Resting an arthritic knee makes it worse. Cartilage has no blood supply of its own. It's fed by movement. Every time the joint compresses and releases, fluid moves in and carries nutrients with it. Stop moving and you starve it. I'm not telling you to run, I'm telling you to keep that joint going through its range every single day. Walking on flat ground. A stationary bike with low resistance. Sitting in a chair and straightening the leg out 20 times twice a day. The rule is simple: motion, not impact. And if movement genuinely isn't working for you, if you've been consistent and nothing improves, go back to number 2. That's usually why. Number 6, once you've stopped feeding the inflammation, feed the repair. Collagen, bone broth, or a collagen powder stirred into your morning coffee. It gives your body the actual building blocks of cartilage and the tissue around it. Omega-3s from salmon, sardines, and mackerel. They work against the inflammatory pathways directly, and vitamin C, which is non-negotiable, and most people don't know why. Your body physically cannot assemble collagen without it. You can eat all the collagen you want. Without vitamin C, it never gets built. The collagen and the omega-3 I take myself are both in that store link I just mentioned. I did a whole video on the 8 foods for this, and I'll link it at the end. Number 7, and this is the health detective part. Your knee is stuck between your hip and your foot, and it takes the punishment for both. Stiff hips mean the knee rotates to make up the difference. Collapsed arches mean the knee drifts inward with every step you take. Either one grinds the same spot thousands of times a day. If you've been treating only the knee and it keeps coming back, the knee was never the problem. It was the victim. Look up, look down, then treat what you find. So let's put it back together. Bone on bone describes a picture. In the research, people with that same picture range from 15 to 81% likelihood of actually being in pain. You are not the X-ray. Wake the muscles back up so the joint has support. Pull the 6 foods for 3 weeks and find out which one is yours. Calm the tissue with cold laser. Keep the joint moving. Feed it the raw materials and check the hip and the foot. None of that regrows cartilage. I'm not going to tell you it does. What it does is change the thing that actually determines your day, how inflamed, how stable, and how well supported that joint is. I have watched people who could not bend a knee walk downstairs normally again. Their films didn't change. Everything around the film did. If you've been told surgery is your only option and something in you isn't ready for that, start with numbers 2 and 3 this week. Give it 3 weeks, then decide. If you want help figuring out which of these is your piece, there's a link below for a free discovery call with me. And if this helped, tell me in the comments. How long have your knees been like this? I read everyone. I'm Dr. Mauldin. Take care of those knees.